We all love to sleep, don't we?
What's a good sleep? Basically, there are two switches in our brain.
Okay.
One is a switch for wake up and one is a switch to fall asleep.
We have Dr. Harshini. Dr. Harshini is an interventional pulmonologist and a sleep specialist.
30 to 40% of the sleep disorders, like insomnia, like parasomnias, like REM sleep behavior disorders, all these happen.
Why are people who are so young and energetic, why are they having sleep issues these days? What about all those people who do night shifts?
So if you see few people, they can sleep even on the roads. Even on a main road, if you put them, they can still sleep. The biggest myth is alcohol induces sleep.
What role does screen have to play? Could be your phone, could be your tablet or whatever. What is the connection between sleep and screen? When does sleep problem become a sleep disorder?
But they don't know that exercising in the night will keep you awake and alert.
Really?
Again, all those age groups who are watching this will not like me after this. So slowly you will go into depression, anxiety, all these psychological and psychiatric issues. And medical issues like hypertension, diabetes, brain stroke, cardiac issue. Most of the patients who come to us are all youngsters.
Hi everyone. Well, after a long, tiring day, what is the best thing you want to do? Well, if you ask me, the only thing I want to do at the end of a long, tiring day is curl up on a comfortable bed and go to a blissful sleep. We all love to sleep, don't we? I mean, who wants to get out of that comfortable, cuddly bed and then run around facing life? Sleep is very reassuring, sleep is rejuvenating, sleep is refreshing. Well, as babies, we spend most of our life sleeping. But somehow, when we grow older, sleep takes a back step. We kind of take sleep for granted. And before we know, we start having problems with sleep. Something that has to come so naturally to us becomes a cause of concern. Well, today, this particular podcast, we are going to bust a lot of myths about sleep. We are going to understand what sleep is. We'll also understand different reasons why we face problems with sleep. And I hope that by the end of this podcast, you would have enough takeaways to overcome some of your sleep challenges. And to discuss all this with us, we have Dr. Harshini. Welcome, Dr. Harshini, to this podcast.
Thank you so much.
Dr. Harshini is an interventional pulmonologist and a sleep specialist. She's the founder of Sleep Therapeutics, which is a sleep clinic based out of Jubilee Hills in Hyderabad. And looking forward for this conversation with you.
Me too.
Well, for a lay person, right, sleep is something as natural as breathing. Right? We lie down on the bed, we put our head on the pillow, and probably 10-15 minutes, or for some people slightly longer, we go into sleep. And then we wake up after some time. And then we don't even think about what happened in those few minutes or hours that we were sleeping.
True.
Right? But from a medical point of view, can you help us understand what is sleep? What actually happens in the mind and body when we are sleeping?
So even in the medical language, sleep should be as easy as you said. But unfortunately, these days, it's not so easy.
Right.
Anyways, normal human being, okay, depending on their age, the duration of sleep differs. But what happens to the biology of sleep is, so after a tiresome day, you fall on bed, you close your eyes. And once you start slipping into sleep, basically, there are two switches in our brain.
Okay.
One is a switch for wake up and one is a switch to fall asleep.
Okay.
So melatonin is one hormone which switches on this sleep switch.
Okay.
And cortisol is one hormone which goes down to get off so that they slip into sleep.
Okay.
So these two hormones, one directly proportional and one indirectly proportional, they make you fall asleep.
So melatonin increases, cortisol reduces.
Yes.
So when this happens, we sleep basically.
Yes.
Okay.
So as we fall into sleep, there are 4 stages of sleep.
Okay.
So basically they're into 2 and then subtyped into 4. One is a REM sleep, which is a deep sleep, and other one is a non-REM sleep, NREM sleep.
Okay.
So this NREM sleep again has stage 1, 2, 3.
Okay.
So total we go like this, from stage 1 of NREM to 2 to 3 and then to REM.
Okay.
So sleep happens in cycles.
Okay. What is REM?
So REM is a deep sleep.
Okay.
Yeah, so REM sleep is a deep sleep, NREM is a light sleep.
REM is some sort of an abbreviation or
No, it's a REM sleep.
REM sleep. Okay,
Yeah.
it's just the name is
Yes.
REM sleep. Okay.
So when basically the abbreviation, if you want to expand, it's a rapid eye movement.
Okay.
But now people get confused when it is a deep
Okay.
sleep, it should not be rapid eye movement.
Okay.
So, but there's a lot of, again, biology
Okay.
interfering
Okay,
with
we'll
it.
not go very deep into
Yeah.
that.
So in a REM sleep, which happens for 1.5 hours in the entire sleep, otherwise the remaining hours, like if you're sleeping 8 hours, 8 minus 1.5 hour, everything is in NREM sleep,
That is a light sleep.
light sleep.
Okay.
So again, in this NREM, N3, so the third stage of NREM is a transition to deep sleep.
Okay.
So sometimes we consider it as a deep sleep, sometimes as a lighter sleep.
Okay.
But basically it's a transition stage.
Okay.
Okay. Now, taking all this, each cycle from NREM N1 to REM, the complete cycle takes 90 minutes of time.
Okay.
So like that, we need to complete 5 cycles of this whole process
So 5 cycles of 90 minutes
each.
Wow.
So that is when we complete our sleep.
Oh.
That's why dreams can also happen in stages. So sometimes you get 5 dreams, 4 dreams,
Right.
different
So
types
each
of dreams.
cycle-
Yes. Each cycle may one dream will happen.
Okay.
So that can happen. Sometimes it's a continuity as well.
Right.
So this is all the biology of sleep, and there are so many substances in our brain, so many hormones which are involved for you to fall asleep and also for you to wake up. When there is a chemical imbalance, that is when the sleep disorders do happen.
Right.
Like not everything every time, but at least 30 to 40% of the sleep disorders, like insomnia, like parasomnias, like REM sleep behavior disorders, all these happen because of the chemical imbalances in brain.
Okay.
And the other 60 to 70% of them, they are because of some windpipe issues.
Okay. Breathing, basically
Breathing.
oxygen not reaching the body properly.
Yeah.
All right. All right. Okay. So what is the difference? So recently I was reading an article that was published by the medical journal at the University of Michigan. So this was a study which was trying to identify which is the age group where there is maximum sleep issues, right? A few decades ago, it was 60 years and above, people who are 60 years and above who are facing a lot of issues, and that is probably more a biological or an anatomical thing. But this research says that it is shifting to early 30s, late 20s. So why is this happening? Why are people who are so young and energetic, why are they having sleep issues these days?
So very nice question. And the study is so practically true, like what we see every day also, it's the same thing. So when I started this center, Sleep Therapeutics also, I was planning more facilities for more than 60.
Okay.
So even after doing a fellowship and understanding things. But practically, our books are also printed much old, you know.
Right.
So, but practically what we see is most of the patients who come to us are all youngsters,
Okay.
working professionals. So reason number 1 could be stress. But again, stress is sometimes wrongly put these days. Okay. So it is like this. If you're not sleeping well, whatever stress is there in the entire day, that can accumulate.
Right.
And a sum of like 30 days of sleeplessness, the stress accumulation. So it again leads to sleeplessness.
Right.
So, but the other way around, we don't know how to balance our diet. We are not knowing how to balance our work and life.
Right.
We're not knowing how to do a balanced exercise. Either you're over exercising,
Right.
either you are not exercising.
Correct.
So imbalance in everything, imbalance in diet, imbalance in work life, and imbalance in exercise,
Right.
imbalance in your sleep hygiene. So
Right.
there's something called sleep hygiene as well.
Okay.
So you need to do something to have a good sleep. If
Correct.
you're not doing those small things also, naturally sleep will get affected.
Right.
So these days, put together, I must say it's more of a lifestyle issue.
Lifestyle issue. So previously you said 5 cycles of 90 minutes each. So that comes up to around 7.5 to 8 hours. Probably not more than the luckiest 5-10% of people would be actually getting 8 hours of sleep these days.
Correct. Most of them, they work intermittently. Like they feel that, that's what I said, sleep hygiene is also out of balance these days.
Right.
Because people think that if I sleep 4 hours, I can wake up, I can work for 2 hours, again I'll sleep for 4 hours. So
Right.
actually that doesn't work.
Doesn't work.
Yeah.
So that reminds me of something else that people very proudly talk about, including me sometimes, power naps.
Power naps.
Right? Everybody wants power naps, like 10-15 minutes of sleep and you feel energized again. So probably it does make one feel energized temporarily, but does it actually make up for the sleep, the long hours of sleep that a person has lost?
So again, there's a research talking about power nap. So nap itself means it's a short sleep, right? Could be 10 minutes, 15 minutes, or maximum of half an hour. So this is not going to compensate your overnight sleep.
Right.
Overnight sleep is something which is a mandate.
Okay.
And a power nap is just a supplement.
Right.
And how many power naps are actually required? It's only one. At the
Okay.
most, the second one of 10 minutes to 15 minutes, not more than that. But generally, if you're having a good sleep in the night for 6 to 8 hours, and in the daytime, after lunch, like 1 hour after lunch, if you want to have a half an hour to 45 minutes of nap, that's a good sleep.
Okay.
Sufficient for the entire 24-hour cycle.
Okay.
Sometimes it's not like that and we wake up too early. So maybe we want to take 15 minutes at 11 a.m. and then 15 minutes at 4 p.m. or 5 p.m. It's still okay.
Right.
But not really more than that.
Okay.
Because these power naps, multiple power naps themselves cause an issue called insomnia.
Okay. So because you're sleeping in short bursts, you are not able to sleep long. Is that the reason?
Yeah. So you're sleeping in short bursts multiple times in the daytime, and hence you are unable to sleep in the nighttime.
Right. Right.
So that will disturb your circadian rhythm.
Right. Can you speak a little about circadian rhythm? A lot of people probably have heard it, but don't actually understand the kind of impact it has, not just on our physical health, but also on the mental, emotional health.
Right.
How does it work?
So circadian rhythm is very simple. Whenever the sun rises, so we have to wake up, and when the sun sets in, we have to sleep.
Right.
This is a very common thing which is discussed from ancestors. Okay. So how and why it works like that means actually human body has an internal clock. So what the sun and moon is all external clock. So the human body's internal clock runs anywhere between 20 to 26 hours.
Okay.
Okay. So on an average 22 to 26 hours.
Right.
For example, my clock is running at 22 hours.
Okay.
Okay. So definitely every day I have to change my timings.
Right.
Like today at 4 a.m., tomorrow at 2 a.m.
Correct.
like
Correct.
that.
Right.
But why I'm not doing that? The reason is the sunlight exposure, whatever sunlight we're getting exposed to before 11 a.m. in the morning. So this light will pass through our retina, our optic nerve and our brain. So it will reach our wake up center.
Okay.
So it will also reach our glands and it will help release melatonin hormone.
Okay.
So from 11 a.m. the melatonin hormone production starts and it peaks at around 8 p.m. to 9 p.m.
Okay.
So as it is peaking, so we feel drowsy, and in the midnight at 12 or 1, it's completely at its peak. So you are in a very deep sleep.
Okay.
And after that, it starts coming down.
Okay.
So vice versa happens with the cortisol. Now, when you say the sun is up, you're exposed, cortisol is in its peak. So you're fresh, active, working, and melatonin is in dip, just started raising.
Right.
At the same time, if it's the moon, it is vice versa.
Okay.
So basically, our hormones are in relation with the sunlight exposure.
Right.
That's why when sun is up, we have to be awake, and when sun is down, we have to sleep. So this is the concept of circadian rhythm.
So what about all those people who do night shifts?
Yeah, definitely.
What happens?
Yeah, definitely they are like there's a lack of quality sleep. But again, I don't say that you should never do night duties. So in this also there are two types of personalities. One is a light sleeper and one is a deep sleeper. Okay. This is two phenomena, natural phenomena. So if you see few people, they can sleep even on the roads. Even on a main road, if you put them, they can still sleep.
Correct.
Okay. And the sleep quality is so good, they fresh up very much, like they wake up very much fresh. At the same time, somebody who is put in a 5-star hotel with all proper, sleep facility, even then they cannot sleep. Or even a light pin sound can also wake them up.
Right.
These are light sleepers. This can come as a genetic thing, or it's a natural phenomenon. So all these deep sleepers, they are eligible to do night duties.
Okay.
And all the light sleepers, if they do night duties, they might fall into an issue called insomnia.
Okay.
Yeah.
Okay.
So there are categorization. So nature categorized everyone.
Different ways. Right, that's true.
So if somebody, that's why not everyone who is doing night duty will have an issue with it.
Correct.
Only they get adjusted and they can sleep in the daytime. And there is a hygiene and a schedule for a night shift worker, so as not to fall ill.
Right. So I think sleep is one area where there are maximum misconceptions and myths floating around.
True.
What is the funniest thing you have heard in terms of myth, sleep myth, that you would want to burst?
Oh, there are a lot of myths. The biggest myth is alcohol induces sleep.
I actually wanted to ask you that particular question. Does alcohol actually help a person sleep better?
No, definitely not. See, alcohol induces sleep because it's more or like an anesthesia.
Ah, right.
Okay, so it kicks in sleep very fast. But you see, anytime anyone consume alcohol, you ask them, did you sleep properly? And are you very happy and fresh the next day? They're actually not. The reason is it will shorten the deep sleep.
Okay.
So this NREM sleep, whatever is there, NREM stage 1, 2, so that stage 1 happens very quick. So they fall asleep quick.
Okay.
But this cycle, whatever is there, it's not getting completed.
Okay.
That's the reason the quality of the sleep is affected.
Okay.
So they're not fresh, they're not very happy, even though they consume alcohol.
Right.
Even funniest thing is when we started this center, Sleep Therapeutics, I was sharing this idea with some of my friends, cousins, and medical and non-medical people.
Okay.
Naturally, medical people understand, but non-medical people won't, right? So I was just taking their inputs on what they're thinking about it. So they told me only one thing: why should we even come and consult you and pay some X amount? Instead, we can just buy a bottle of whiskey or vodka and just, drink and sleep.
Correct.
So sounded funny, but most of people told me the same.
Yes.
So
No, I agree. I mean, some people whom I also know, one of the reasons, I think they're probably on the verge of addiction or something like that. When we ask, why do you have to drink? They said, I need to sleep.
yeah.
It helps me sleep.
Yeah, actually, you see, I don't say most of the people, but at least maybe 1/10 of the people, they consume alcohol only to sleep.
Yes.
They think that otherwise they have no craving for it, or they don't feel fun in having alcohol also. You don't believe most of the patients who come to me, mostly housewives. So they say that, Madam, I want to talk to you in private. I say, okay, what it is? Then after everyone leaves, then they say that, Madam, I started consuming alcohol. Even then I'm not sleeping.
Okay. So to sleep, they picked up the habit.
Yeah.
Oh.
So they're all not modern housewives whom I'm talking about, the very traditional, conservative families.
Okay.
So even they say this.
Right. What about tobacco?
Tobacco is absolutely not safe for a good sleep. See, the nicotine content, whatever is there in tobacco or cigarettes or anything, so this is going to increase adrenaline. And adrenaline, not just adrenaline, it is going to increase sugars and it's going to create insulin resistance.
Okay.
So now this concept of increasing adrenaline and increasing sugars will disrupt sleep.
Okay. All right. Right.
So naturally, any bad habits are bad for sleep
Bad
as
for
well.
sleep, yes.
But alcohol is the biggest.
Right.
Yeah.
Usually one trend that we see, probably all of us do, whenever we have to work more or, do something else, one thing that we always compromise on is sleep. We always think, I'll stay awake 2 hours extra and I'll finish my work. or I'll wake up 2 hours early and I'll finish my work. Somehow, people don't understand the importance of sleep. So, for all the viewers, if you have problems sleeping, then the dark circles under your eyes is the last thing you should be worried about, because there are a lot of other things that lack of sleep can actually cause. What are the health issues that one can face if
So
there
that's
is inadequate
a really
sleep?
long list, I must say. If there is an inadequate sleep, the short-term effects, like for example, one day inadequacy is there. The next day, headache,
Right.
muscle cramps, body pain, generalized weakness or fatigue, lack of concentration, lack of motivation, lack of energy. Okay, these are the things which are acutely the next day itself you can feel.
Correct.
Anger, irritability, lack of patience, all these things.
Why does this happen?
So this is because sleep is restorative. As you said, it is a relaxation, it is a restoration.
Right.
So when we sleep, whatever stress is there, or whether it is by in virtue of like medical ailments or otherwise external physical work done by the body or by mind. So everything put together, I'm talking as stress. So and toxins.
Right.
So the toxins get accumulated in our body. Okay, and there are so many metabolites which has to be discarded. They're all accumulated in our mind as well.
Okay.
When we sleep, toxin release, bad metabolite release, chemical balance, hormonal balance, all this happens in sleep.
Okay.
So if you're not sleeping, naturally all of this go into imbalance.
Right.
And I just told about one day of lack of sleep, but if you're not sleeping properly for some time, could be for a month or more than that, then you're going to face this lack of even not just lack of something like concentration or motivation, but you'll have emotional hues as well.
Right.
So slowly you will go into depression, anxiety, all these psychological and psychiatric issues.
Right.
Along with this, once sleep deprivation sets in the night time, excessive daytime sleepiness sets in on the other side.
Right.
So this excessive daytime sleepiness, this can lead to car accidents if you're driving a car.
Right.
Or it can lead to, sleeping in the workspace, which
Right.
can actually lead to occupational issues.
Correct.
So all this. And medical issues like hypertension, diabetes, brain stroke, cardiac issue, indigestion, acne, dark circles, so everything.
So basically, if we develop good sleep hygiene and if we discipline ourselves to sleep at least 6 to 8 hours per day, a lot of these issues might not affect us. I cannot say
Definitely.
will not, but might not.
See, most of the, we call it resistant hypertension, okay? Actually, cardiologists require sleep physicians more than anyone, I must say.
Correct. Right.
Because the very first impact is on heart, is on high blood pressure, okay? So when you're not sleeping properly, we say something called resistant hypertension. So one starts becoming a hypertensive at the age of 30 or 40,
Okay.
where they should not become a hypertensive in the first place.
Right.
So generally, like a decade back, 30-year-old would never go for a medical test
Correct.
on a routine screening purpose. But now we are seeing so many people coming with the screening tests. And in that, high BP is recorded, pre-diabetics.
Right.
So all these resistant hypertension means they're diagnosed early, one medication is started, the BP is not in control, again a second, again third. So n number of medications are being added, still the BP is not coming into control.
Right.
So this is called resistant hypertension.
Okay.
If you ask one question to them, if you're able to sleep well or not, either their duration is less or their sleep is of poor quality.
Okay. How do you define a poor quality sleep? What does it mean when you say because a lot of times we sleep 8 hours, but still we don't get up fresh.
Yeah.
Even after 8 hours of sleep, there is that lethargy. You have to force yourself out of bed. Your head doesn't move from the pillow.
True.
But it's not as if you're waking up multiple times. So it will be a continuous stretch of sleep, but still will not give the relaxation. So what is that? Is that what you mean by poor quality sleep?
Definitely yes. So for a sleep, what's a good sleep? Good sleep is having a good duration, which is 6 to 8 hours for an adult, and having a good quality. So how do you see quality is The next day you have to wake up fresh. You should be able to do all your tasks. Your concentration should be good. Your mood should be good. There should not be any acidities or digestion issues. And the next thing is your muscle cramps or body pains. They should not have any relation with your sleep.
Okay.
Headache should be less. Irritability, anger spikes should be less. So all this physical, mental, emotional health maintenance should be there.
Okay.
If that is there, probably your sleep is good. There are other reasons for all these issues, but if they're coming together, then we definitely have to think of the quality of sleep.
Right.
Mainly the lack of freshness in the first hour, as soon as we wake up.
Right.
So after quality, generally people ask me, what is efficiency? So yes, efficiency is definitely an indicator for a good sleep. So we need to calculate our sleep efficiency. We can calculate.
Okay.
Subjectively, if at all we go to bed at 10 p.m. And we are waking up at around 8 a.m.
Okay.
Okay, so it's a 10-hour sleep. So time spent in bed so time in sleep. So it's the time in sleep divided by time spent on bed.
So basically, if you're falling asleep early,
Yeah.
then your efficiency will be more.
Yeah, and if you're
taking a
able to
long
maintain it.
Maintain it, right,
Yeah.
right.
So you should be able to fall asleep within 30 minutes after going to bed.
Right.
And you should be able to maintain the sleep till morning.
Okay.
So you might wake up once or twice, but that could be for 5 minutes or 10 minutes, and that's okay.
Right.
But if it's more than 1 hour, then probably the efficiency is coming down.
Right.
So simply we make a calculator like this, make a calculation like this. Time spent in bed for how much time you're actually in sleep.
Sleeping. Okay. What are the different kinds of sleep issues that people have? So you spoke about insomnia. That is one of them, which is something a lot of us keep hearing also. What are the other kinds of sleep problems? That is first question. Second is, sometimes because of various reasons, we don't have good sleep. Okay. Now this might happen twice a week or thrice in a fortnight or whatever. How do I know whether what I'm having is an occasional night of bad sleep, or is it a disorder or a chronic thing? How can I distinguish between both these situations?
So there are so many sleep disorders. One is obstructive sleep apnea. The second one is insomnia. The third one is parasomnias.
Okay.
So these are the major classifications, and so many more. So 70% of our sleep disorders are all related to our breathing patterns.
Okay.
So generally what happens, people who are obese, they have fat tissue over their neck. So now this fat tissue is going to cause an obstruction to the windpipe when people fall asleep.
Okay.
Second thing, there are few people with internal obstructions, like a deviated nasal septum, sinus issues like sinusitis, and allergic rhinitis.
Okay.
And anyone with adenoid hypertrophy or tonsillitis. All these people with genetic issues where the face structure itself is causing problem to the windpipe when they fall asleep or go to bed. So as they're falling asleep, the muscles around the neck get relaxed. So the deeper they go into sleep, the better relaxation the muscles will go into.
Okay.
At this time, these external pressures or the internal pressures, they'll obstruct the windpipe, they'll narrow the windpipe. So the airway will become narrow, leading to lesser amount of air entry, lesser amount of oxygen entry. So this low oxygen signal is going to reach brain, and brain will give a wake up signal.
Okay.
Because you have to wake up and you have to breathe.
Right.
So this breathing issue or low oxygen issue is actually making you awake.
Is sleeping position also one of the factors? Like I've seen some people have like a pile of pillows, so kind of compresses the neck. Or if you're sleeping on your stomach, does that also? So sleeping position also has a role to play in these kind of things.
So this complete picture is actually obstructive sleep apnea, right? So in this obstructive sleep apnea, what happens is people when they sleep towards one side, sometimes they snore less. So basically the symptoms of this are also snoring and daytime sleepiness and choking at night. Now people who sleep at one side, sometimes they say that I feel better, I don't snore so much. When I sleep straight, I will.
Snoring is more, yes.
So it depends on the angle of obstruction as well.
Okay.
So many times it is in the straight position with head towards the bed, more towards the bed. So it's in a straight position where you will be getting more of sleep apnea episodes.
Right.
So then body tries to automatically adjust pushing you to sleep one side, okay, or the other.
Okay.
Now, even that stage is crossed. People really can't sleep straight because their tongue will fall back and it'll obstruct.
Okay.
So if their tongue has to be down, it's a matter of gravity. They'll try to pile up 1 or 2 pillows.
Right.
That position will actually open up their windpipe to some extent.
Okay.
Even that stage also crosses, then they'll complain of sleep apnea symptoms.
Okay.
Yeah.
Alright.
And sleeping on their tummy, generally what happens sleeping on their tummy is the base of the lungs get opened up. So the oxygenation improves to the body.
Okay.
That's the reason people sleep on prone positions.
Right.
But definitely sleeping in these positions for a very long time will lead to muscle catch, and neck pain and so many other, because this is not a very comfortable position for all the muscles.
Right. So when does sleep problem become a sleep disorder? Where is the line?
Yeah, that's a nice question again. So generally a few people are very much obsessed about their sleep. I didn't sleep, so I had this probably. So they think too much.
Right.
So now, first thing is we have to definitely think and check if we are sleeping well or not, right? So the sleep efficiency or the quality or duration, if you're checking it, it's okay. Now, there are few times where people don't follow sleep hygiene things.
Okay.
Like they come back home from work and they might be wearing some, outfit which is for an office, or jeans if they go outside, or some party wear. They just fall in bed and they try to sleep.
Right.
So wrong outfit, not taking a shower before going to bed, or like in the late evenings.
Okay.
Having dinner and then immediately sleeping.
Right.
Having full meal, like your tummy is just so full, you had a very good biryani, you had high sugars, you had alcohol, and then you're trying to sleep. So these are all breaking your sleep hygiene.
Okay.
So technically, the moment you come home, you should freshen up, wear a nightwear, comfortable dress. You have to put your temperature, light, fragrance of the room, good enough, ambient enough, that makes you fall asleep. And you should not watch screens before, like 1 hour before sleep. And you should not have coffee after 7 p.m. No exercise after 7 p.m.
Wow.
So these things, when you're following, you will generally fall asleep. And when you're doing some basic breathing exercise also, you will fall asleep. In case you're breaching these things, then you are in a sleep issue.
Right.
Sometimes people realize these and they will sort out on their own. Now that becomes a problem. Sometimes, even after doing everything, listening to podcasts like this and multiple other podcasts as well, and then they're trying to fix everything, because patients come to me, they say that I'm having chamomile tea, I'm having hibiscus tea, I'm having this, that, massages, all thing, everything, and sometimes I get points from them. Okay, this can be done.
Okay.
So they do everything because they are like encyclopedia of sleep.
Okay.
And they tell me everything. Even then they're facing a trouble. The reason could be sleep apnea, which is a physical sleep health issue.
Right.
It can be insomnia because of genetic reasons. It can be insomnia because of hormonal issues or nutrient deficiencies.
Right.
So these are all disorders. So even after following a very good sleep hygiene, still you're having a trouble with your sleep. That means you might be facing a sleep disorder.
Some sort of disorder.
Yeah.
Right. So one thing that caught my attention, and all of us I think are guilty of it, is screen. Right. What role does screen have to play? Could be your phone, could be your tablet or whatever. What is the connection between sleep and screen?
So anything which emits light, could be a phone, tab, laptop system, TV, whatever it is, whatever is emitting light, so this light will have blue wavelength.
Right.
Okay. So the blue wavelength is one light which passes through a retina, again to the awake center. It makes you awake.
Okay.
So it's a stimulus you are giving to your brain that please stay awake. Because as I said, in circadian rhythm, it's the sunlight which is going to keep you awake.
Right.
So that's how nature designed our body, right?
Right.
Now with artificial lights which is having blue light, if you're waking up yourself, naturally you're unable to fall asleep.
Right.
So at least 1 hour before sleep, you have to switch off all the screens.
Right.
Yeah. They can certainly listen to the podcast while sleeping, but only with the headphones and not looking at our faces.
These days I've seen a lot of people listening to relaxation music. If you go onto YouTube, there are like thousands of sleep music. It's called, the name itself is sleep music. Does that help?
Yeah, to some extent, because in all the senses, so all the 5 sense organs, whatever we have, all the 5 will help in sleeping. So in that sense organs, eye is one sense organ. So any light calming music will definitely help you sleep.
Okay.
Now the point is, only till you're feeling drowsy, till then only you have to keep them on. After that, you certainly has to remove them
off.
and definitely not put like AirPods in the ear and sleep.
Yes. So we spoke about melatonin, which has to be high, and cortisol, which has to go low. There are also other hormones these days, because of Instagram and WhatsApp. We know that there are things called oxytocins and serotonins and all these things.
Yeah.
What role do these do? They're basically called happiness hormones,
True.
What role do these hormones play in sleep?
Yeah, so oxytocin, serotonin, they have to be in a balance all the time. So oxytocin will put you to sleep. Even serotonin will get dipped when you are falling asleep.
Or it reduces?
Yes, it reduces. In the morning time, when you wake up and when you're getting exposed to sunlight, right, that is when the serotonin level picks up.
Okay.
So you feel more happy and more bright in the daytime, actually.
Correct.
So this is how it happens. But directly or indirectly, by either putting you to sleep or waking you up, they are involved in the sleep cycle.
Right.
But of course, they're not majorly. So that's why if you see in patients who are suffering from depression, sleeplessness is a symptom, or excessive sleepiness is also a symptom.
Right.
So why? Because in depression, serotonin level drops.
Right.
So that is leading to this symptom.
Correct.
So it's indirectly related, but they are important.
Okay. So at OdinSchool, a lot of early professionals who come to upskill and who come to transition their careers, they're mostly in the age of 20 to 35 probably. That is the age group where people come. So like we said in the study also, that is the age group where a lot of people are facing sleep issues these days, right? For whatever reason. The reason could be multiple. Is there something that they can do to analyze themselves or to understand themselves better and find some solution so that they can sleep better? Because going by what you said, a lot of things like stress and lack of concentration and a sense of unhappiness, could be anxiety, could be depression, are all directly related to sleep, the quality of sleep or the efficiency of sleep. What can one do to improve their quality of sleep so they can focus better and live a better quality life, basically?
Yeah. So the golden rules or the suggestions is, first thing, we should not be too over ambitious. See, overnight you want to become Ambani, overnight you want to become president and prime minister. It's not really possible, it's not practical. So achieving something is a marathon. So people think it's a 100-meter race. It's definitely not.
Right.
Now, in a marathon, we have to, if you want to run a marathon, any marathon runner, he takes adequate rest.
Right.
So few laps, one after the other, then he picks up his speed.
Correct.
Right? So this logic has to be understood by people who are in this age group.
Right.
So most of times this logic is missing in the age group, and they're struggling too much. Later they are getting burnout and they are unable to work or achieve.
Okay.
Right? So this is one thing. Why I'm saying this is, it's not just the sleep which causes psychological issues or anxiety. It's again the anxiety which is leading to sleep.
Yeah.
So all this anxiety, stress, overthinking at night time once the lights are off, all this will lead to sleep related issues.
Right.
It will slowly push into insomnia and poor sleep quality. So what one has to do, understand this logic. That's the first point. Second point, follow the sleep hygiene. As I said, keep your environment better, wear good clothes and have a shower, have dinner 2 hours before, and then not consume any alcohol in the evening so that it won't disrupt your sleep. get adequate sunlight exposure in the morning. Yes, you get tanned, but tan is good.
Tan is good.
Tan is good for sleep, and these days brown is anyways fashion, so it's okay. So tan is good for sleep. You have to get at least half an hour of sunlight exposure before 11 a.m. Naturally 9 to 11 is very hot, so before that it would be much better.
Right.
And balanced diet, so proper micronutrients, so that micronutrient absorption is very important. All these things has to be followed. This is the second thing. Third thing is, we cannot avoid stress at times.
Correct.
Tomorrow is my exam. I cannot avoid stress. So we are not yogis, and the age group you spoke is really not that matured enough to understand what is, how to balance stress. So the easiest way is to do deep breathing exercises.
Okay.
You're facing too much of stress and you're thinking about the same thing even though you don't want to think about it. That too when the lights are off in the night.
Yes.
Practice some deep breathing exercises. Take a deep breath, hold it for 10 seconds, release a breath, and then hold it for 10 seconds and do this repeatedly.
Okay.
This is the simplest way to release stress.
Okay.
Next thing, second thing, to release stress, you need to be on some physical activity. Okay?
Right.
Playing your favorite sport. So in school, sports are so important. Then why are they not so important as we grow up?
Right.
So as professionals, we don't play. As mothers, they don't play. Grandparents don't play. But it's very important to play a sport or workout. Give half an hour of your time for yourself.
Right.
So if you're exercising, it's not just that you're putting your body in shape, but also you're putting your mind in shape.
Right.
So this releases stress. At the same time, this should not be done post 7 p.m., but any time in the day is a very good option.
I see a lot of people when I drive back home. I see gyms full after 7 in the evening.
Yeah, and 9, 10, 11 also.
9 to 11 also. So basically for sleep, probably the misconception is that you work out, you're so tired, you go back and sleep.
Yes. When you asked me the myths, I was just confused to whether I should say about alcohol or about exercise. Because even people know that alcohol is bad for health and all that blah blah. But they don't know that exercising in the night will keep you awake and alert.
Really?
Yeah.
Okay.
So it's the worst thing anyone can do. If you really care about your sleep, then please do not exercise post 7 p.m.
Okay.
Because see what happens in exercise is, if you exercise, you must be knowing, if you start walking or running, after 10 minutes your body comes into activation.
Correct.
Because your calories are burning one thing, to burn those calories, you're requiring more oxygen, you're requiring hormones, and in that adrenaline is a hormone.
Right.
It's a chemical.
Right.
So there's an adrenaline rush. So a serotonin rush. So everything gets rushed up. Your body gets heated up. Your metabolism is increasing. So you're activating your system. Technically, when you should activate your system, that's in the morning.
In the morning, yeah.
Of course, not everyone is a morning exercise person. For example, I hate exercising in the morning. So yes, there are people who don't like exercising in the morning, but that's okay. They can do it anytime before 7 p.m.
Okay.
Because again, there's some time for the body to relax.
Calm down before it
Yes.
sleeps.
And anyone who is having a poor sleep quality or sleep issues, they should always try to work out in the morning.
Okay.
Even a brisk walk also will damage their night sleep.
That's very interesting. I think that's one of the biggest myths we have.
Yeah, even more than alcohol.
Even more than alcohol. That's true. So in different stages of life, the duration of sleep changes, the quality of sleep changes. So what is it that is causing this kind of change? Like, I don't like how I used to sleep in my 20s. I don't sleep like that now.
Yeah.
What is it that is causing these changes in the body?
So it's naturally the structural changes and the hormonal changes, I must say. See, natural phenomena is also the requirement of sleep is different for different age groups.
Okay.
For a newborn, if you see, out of 24 hours, 18 to 20 hours, they need sleep. After 1 month, the requirement reduces to 15 to 16 hours.
Right.
Till they go to school, they might require 12 to 14 hours.
Okay.
Once they start going to school, till high school, they might require at least 10 to 12 hours.
Right.
From high school, like a typical adult, I must say, any adult will require 6 to 8 hours of sleep.
Okay.
Post 60 years of age, they'll require only 5 to 6 hours of sleep.
Okay.
End of the day, what remains constant is the quality of sleep. Everyone should sleep with a good quality, but the duration changes.
Okay.
So now, the second thing is the energy you have, the capability to hurt your body is more in 20s, right? But the
That's
same
true.
thing is not there in 30s.
Right.
So people, generally they come to me, they say that in my engineering, I used to sleep at 3 a.m. Still I used to wake up at 8 and I used to go to college. So, and sleeping early is a sin or it's a shame in my hostel.
It's become a fashion, saying that I did night out.
Night out, yeah, sleepovers. Yes, slumber parties, all these are, they're in trend. So what a teenager can take, definitely a 30-year cannot take. So the same person who did all this in their 18 or 20, after their 30s, suddenly they can't stay in a party more than 12 a.m.
That's true.
Right? They want to just go back.
Correct.
And once you're entering into 45s, 50, then 9:30, 10, and then I just want to go hit my bed.
Right.
So definitely the body will not cooperate in virtue of the hormonal changes and the physical structural changes.
Okay. Okay. So one more very funny question. Okay, I find it funny, so probably you can clarify. So a lot of my friends who are not able to sleep as in they sleep early. They as soon as they are on the bed they sleep, but all of them, okay, including some of my family members, they are up around 3 o'clock. 2:45, 3 is when they wake up, and after that they cannot sleep for an hour, and then they go back to sleep around 5 and sleep till 7:30. What is it about this 3 a.m. syndrome that people are falling prey to?
So if you ask any person who is more than 60 years, they'll call it Brahma Muhurta. Okay.
Yes, that is another term I've heard in this context.
So I really don't want to create controversy in this early age, but the concept of Brahma Muhurta also works 3 a.m. It actually works for people who sleep at 7 p.m. Right? It's not for people who sleep at 10 p.m. or 11 p.m. This is one thing. So really no offense to people who follow it, but this is how it is. Second thing is why they wake up at 3 a.m. Generally, there are two angles which we look into it. First thing is probably their 4 cycles of sleep would have completed.
Okay.
So some people, they require only 6 hours of sleep, or like they might require even less also. So if the quality of the 4 cycles of sleep is done, so they might feel fresh and they might wake.
Okay.
This is one thing. After that, they really don't know what to do and they feel guilty that they woke up middle of the night, so they go back to sleep. This is one thing. Second thing is, so this generally happens in more than 60 years of age.
Okay.
Most of people, they complain and they try to take some sleep medication and sleep again.
Okay.
Because they don't have anything to do once they wake up also, right? The second part is people who are having allergies, asthmas, nose blocks, sinus issues. All these people, the highest temperature drop happens at 3 a.m.
Okay.
Not exactly 3, somewhere
Around
15
3.
minutes plus or minus.
Temperature of what?
Of the climate.
Environment.
Environment.
Okay.
In spite of you using ACs, humidifiers and everything, still the environment plays a role. The temperature drop happens. Because of this temperature, they get congestions. So for that congestion, the secretions and all, they irritate their throat or nose or their airway, and they tend to wake up.
Right. Right.
So they're all called exacerbations.
Okay.
But they're for a pretty short time.
Right.
Once they wake up, they go to washroom and then they clear the secretions, they're fine, and then go back to sleep.
Right. Right.
So this is a medical issue.
Another trend that we are seeing, a very unfortunate trend that we are seeing in the last 2 years or something, a lot of people in their early 40s are suddenly dying. This trend we have not seen previously, but now, it could be celebrities. So many celebrities of that age group have suddenly collapsed. People who are apparently fit, who work out, who do very health conscious. And even among my own friend circle, I've had a few people who, just collapsed like that. Why is this happening? Is there a connection between the lifestyle and this phenomenon, or is it something else?
So this is very simple actually. Only thing is people don't have awareness about it. So most of the people, for example, after this show, you go to 10 people and you ask them how many will snore in your age group. Okay? Out of 10, at least 6 to 7 people snore.
Right.
But they would be fit. You ask only people who do gym and who are fit, lean, all good. Okay? So 6 to 7 people say that I snore. And then the second question you ask them, do you feel it is abnormal? They say no. They say, I'm feeling it's normal.
Okay.
So this is another third myth which is very popular.
Right.
Now, how is it related to the question you asked is, so people who are having any obstructions, their air entry is reduced. So the oxygen which is going to their body is less.
Right.
And this is sleep apnea which happens at night time. But in the night time when the oxygen is less, the muscular oxygen is used.
Okay.
Wherever there are deposits of oxygen, whether it's heart, muscle, organ, from everywhere, the oxygen is used.
Right.
That's how body tries to compensate, right? So if not everything, then the body will wake you up. So now people who are having short of oxygen at night time, when they go to gym and when they try to do more amount of activity, there's no oxygen reserve in most of the places, including their muscles.
Right.
Initially, they go into fatigue very early. They say we have muscle cramps, and then they assume it to be muscle knots, then they get physiotherapy and so many things. So sometimes even they feel chest pain or breathlessness, but they think it's just normal because it's in the activity, it's fine. Now the reserves are over, heart tries to compensate this oxygen by pumping at much higher rate.
Okay.
So sometimes they even feel palpitations, but they don't understand. They think it's because of the high intensity workout they're doing.
Right. Right.
So high intensity workout whenever you're needing, all your muscles and all your organs require more amount of oxygen.
Right.
But from where do we get that oxygen in that short period of time when there is no reserve? So that is when heart pumps in completely, in such an overactive and hyperactive mode that it stops after a period of time.
Right.
So sudden cardiac deaths are directly proportional to obstructive sleep apneas.
Wow.
So people who snore, people who have daytime sleepiness, concentration issues, and people who wake up repeatedly, go to washroom, use loo for more than once in the night, and profusely sweat, have fatigue, muscle cramps, all these people, they might be having obstructive sleep apnea, they might be having oxygen, reserve issues, and they are more susceptible for these sudden cardiac arrests. Yes.
Doctor, with all this discussion we have had, one thought that comes is, irrespective of the kind of health issue, right? It could be something as simple as, not something as simple as like palpitations or feeling exhausted or whatever. I think the first step should be to analyze your sleep and work on your sleep. Am I right in saying so?
100%.
So I think if you are able to rectify your sleep, then a lot of your health issues will start feeling better.
Yeah. And actually, the another point is people get fat if they don't sleep well.
Oh, really?
Yes. So, as I said, there's a hormonal imbalance which happens if you don't sleep well, by quality or by duration. In that hormones, there are few hormones like metabolic hormones. Insulin, ghrelin, leptin, all these are metabolic hormones.
Okay.
So, it's a basic chemistry basically. Whatever food we are taking, oxygen and hormones, all these three combine to produce energy.
Right.
So, there's a hormonal imbalance, there's an oxygen shortage.
Okay.
So, the food directly converts into fat.
Oh.
Because you don't know where to go. So it directly converts into fat.
Okay.
So unexplained weight gain, I'm doing diet, I'm doing exercise, still I'm unable to reduce my weight. So all these people, they have to check on their sleep.
That will be music to the ears of so many people. If you want to reduce weight, people sleep.
Sleep. Yeah.
Reduce half an hour of gym if you need to, go home early and sleep.
And sleep. But at the same time, it's not a good news in other way, right? For people who oversleep, because people who oversleep are double the times of mortality or deaths than people who undersleep.
Oh, really?
Yes.
So this is the other side of the spectrum.
Other side.
So can you explain this oversleeping? Why is too much of sleep more dangerous than less sleep?
See, it's like food. If I have to say in short, it's like food. So if you are undernourished, or if you're eating too much, which the body is not requiring.
Right.
So that we don't call overnourished, but we call it malnourished.
Right.
Right?
Right.
So if you're eating too less or eating too much, how you fall into either lean personalities or, under BMI, underweights, or otherwise you fall into overweights and obesity. It's the same thing with sleep. So this is not just told by me or scientists or anyone. It is told by Lord Krishna in Bhagavad Gita.
Okay.
So he tells, if one wants to become a yogi, he should not sleep too much or sleep less, eat too much or eat less.
Right.
Okay. So now what is this meaning of yogi is, for us, it's a successful person with a successful health, successful career.
Right.
Right?
Right.
So what happens if you sleep too much? See, if you're active, if you're awake, your energy levels are different, your calorie burning is different, your muscle activity is different. So everything is awake and it's running. It's like a machine. Our body is like a machine. If you're not using it, the amount of time you have to use it, it's going into under maintenance. So that's why you should not oversleep.
Okay.
So typically for an adult, it's obviously 6 to 8 hours of sleep with a good quality.
Right.
Yeah.
Again, too much of anything is bad.
Bad.
So too much of sleep is also not too good.
Good.
Another very common thing among the age group that we spoke about, 20 to 35, right? They don't sleep during the weekdays. They do different things. Probably Friday night is the least amount of sleep they get. And they try to compensate all this lack of sleep over the weekend. So the entire Saturday, entire Sunday, they're sleeping. Does that compensation work? Is it as good as sleeping every day, or is that not good at all?
Again, all those age groups who are watching this will not like me after this, but definitely that won't work. See, you have to sleep 6 to 8 hours every day. You cannot sleep for 4 hours and postpone this 2 hours for a weekend. Okay. And in your weekends also, actually, you're supposed to wake up at the same time like your weekdays.
Okay.
When we assess a sleep disordered patient, this is one of our questions.
Okay.
Do you follow the same sleep schedule like the weekday on a weekend as well?
Right.
Most of people put no. So definitely that is also leading to your circadian rhythm disorder, because if you're sleeping like that, generally what happens is your body can't sleep the next day when you want to sleep.
Right.
So the cycle which you're following gets disrupted.
Right.
So generally this should not happen. But what one can do is, by 1 hour or 1.5 hours, probably it's fine. Because see, we are sleep deprived for certain amount of time for various reasons. The deprivation can be fulfilled. But to what limit? By 1 hour or 1.5 hours. But not like 24 hours and 48 hours. That's one thing. And second thing is, they can wake up and they can take a good afternoon nap. So maybe for 2 hours, yes. Actually, it should be only 30 to 45 minutes.
Okay.
But even till 2 hours, yes, for your sleep deprivation to settle down.
Right.
Yeah.
So Dr. Harshini, before we wind up, can you tell us a little bit about sleep therapy? What is sleep therapy and how does it help people who have sleep issues?
So one thing what I want to put in front of you is there is no term like sleep therapy.
Okay.
So it's very strange, right? So actually there's a lot of, in a scientific medical way, there's nothing like sleep therapy. So we feel lucky and nice to listen to this word sleep therapy, because most of patients started saying this.
Okay.
We named it sleep therapeutics just to make it clear for a patient who is passing on the road that therapy is a treatment and this is a center related to sleep issues. So we just wanted to keep it very simple, so we named it sleep therapeutics. So whenever whoever comes to us, most of people, they cannot completely read the name therapeutics. So they start reading it therapy.
Therapy. Okay.
So that's how the sleep therapy set in.
Okay.
And then even we didn't realize about it, but after a few days, when we're doing such podcasts or some interviews, people started asking me the same question: what is sleep therapy? Then I thought, Arey, I don't know about this term. From where did this term come? Then we realized we are pioneers in creating this term by naming our center. Okay.
Yeah.
And otherwise also, there are few therapies like alternative medicines, or otherwise, as you said, music or all these. So they use this term sleep therapy. Any soothing music, anybody who is giving you good fragrance, which is to be put in the room so that you can fall asleep, good aromas, and all these things which help in sleep hygiene, they named it as sleep therapy.
Okay.
So they are not, it's not a real medical word, but it's for alternate things. That is one way. So anyways, we came to that point. So what we do in sleep therapeutics, after this word has been framed, now I gave a definition for that word, at least in sleep therapeutics. So what we do as a sleep therapy means, few of my patients, so they come because they cannot follow a sleep hygiene we give. They cannot follow a sleep schedule we give.
Okay.
So they can't, sleep in the night, they can't wake up in the morning. So for all such people who are actually suffering from a sleep schedule issue and not really a sleep disorder.
Okay.
So those people, we started a term named sleep therapy, and we are actually putting them in that program. So it's technically a program to follow a good diet, good exercise, and good sleep hygiene, so as to get a better sleep.
All right. Okay. What is the one last parting advice, out of all this discussion that we have had, if you would expect the listeners to have 3 takeaways from this entire discussion that they can actually implement every day in their lives, what would they be?
So for this age group especially, see, I don't ask you to compromise on your careers, because I never did that. You have to go ahead, run for your career, but run like a marathon. First thing. Second thing, stress will always kill your food habits, it will kill your exercise, it will kill your stress relieving part, it will kill your sleep. So please do not get stressed up, irritated, and anger spikes, or get anxious for pretty small things. So third thing, there are few big things, big milestones which are going to happen in your life, and like an exam, like an entrance exam, job interview, and all these things. At that time, if you're really unable to fall asleep, please do a deep breathing exercises. So take a deep breath for 10 seconds, hold it for 10 seconds, release it for 10 seconds, and again hold it for 10 seconds. Now this is called a box breathing technique. So the second level of deep breathing exercises, we call it JPMR exercise. So on a YouTube, probably you'll find here and there, anywhere, a JPMR exercise. You can practice it. It is a deep breathing along with the muscle contraction and relaxation. So this will deviate your focus from something else. That is, there are so many flight of thoughts. From that, it will bring your focus onto your breathing, onto your muscle relaxation. It will improve oxygenation, it will relieve your stress, and you will fall into sleep. This is the next thing. So if we leave stress and if we leave ambitions aside, certainly you need to have a balanced diet. Partying now and then is okay, but partying every day is not okay. So you need to have a balanced diet. Please concentrate on your exercise and try to play a sport which you like. Try to have some recreational activity like a school kid has, and maintain your hobbies, and try to have some stress relaxing activity. Then go to sleep on time with a good quality. So sleep hygiene was one thing which we have discussed over this total session. So I think by now you know about sleep hygiene, and you please follow the sleep hygiene. The last thing is that even after doing everything, still you are unable to sort out your sleep related issue, please do not delay. Because after you're attacked with so many lifestyle diseases or comorbidities, probably with medication we have to give a treatment, but the earlier the better. So if you feel that after practicing everything still you're not having a good quality sleep, good duration sleep, if you're snoring, if you're choking, if you're trying to take deep breaths in the night, profusely sweating, any such thing which you think that I have an issue with sleep, please consult a sleep consultant or a sleep physician at the earliest. So that will really sort out your issue. And at 20s and 30s also, there are so many sleep disorders which are there. It could be sleep apnea or insomnia. So please get treated and don't think that a 20-year-old cannot use a CPAP device or should not use a CPAP device. If your doctor is advising, please do follow the advice.
Right. Thank you so much. So people, do not take sleep lightly. Take sleep seriously. Sleep is such a beautiful thing, and you should be able to enjoy. And if you're able to sleep well, like Dr. Harshini said, you'll be able to handle your emotions better. You'll be able to handle your stress better. And once you run that marathon and when you get that success, you'll be able to enjoy the success also better, because you'll be in a happier frame of mind, a more positive frame of mind. And that makes the entire difference between a good quality life and a poor quality life. So sleep is extremely important. So that's it for this podcast. It's been amazing. Lots of insights, lots of myths busted, especially about working out in the night. I think that's an eye-opener for a lot of them. Thank you so much for your time, Dr. Harshini. It was a pleasure talking to you.
Pleasure talking to you.
Thank you.